Hey guys, it's Dr. Emer, and I'm really excited to be doing just an enhancement female sculpting procedure. Remember, we've talked about a lot recently on our lives that it's really important that when you're using fillers and you're doing combinations of different fillers, you're using them to enhance signature features. And our patient here today has a really strong chin, nice defined cheekbones, elevated brows, thick brows. So what we're going to do is we're going to use the fillers to lift the brow, sculpt out and define her lateral cheek, and just support around her mouth and give her a little lip plumping, because as you age, the area of the mouth starts to cave in. Same thing happens to the temple, which is why you get hollow there and the eyelids start to droop. So using volume, we can give some preventative lifting there, and we can enhance the signature features of her, signature features of her face. Yeah. So we're going to start up in the temple. And temple brow area is a really easy place to do. It just feels really strange to patients, and it also scares them because they feel like it's hitting their brain. But it's not. We're just going directly down all the way under the muscle onto the bone and supplying the filler in this area, because what it's going to do when we inject in the midline, it's going to volumize the center part of the temple. Then we're going to reorient, go more towards the eye, and that's going to lift the brow. So we're filling this like a swimming pool. I tell people from the shallow end to the deep end. And we're going to get a nice amount of volumization and lifting in that area. Perfect. So we're going to hold right there. And I always tell people you might have a little pain tomorrow when you chew. Oh, someone took my needle top here. So here it is. 1 second. You might have a little pain when you chew tomorrow because the muscle of chewing is in the temple. And so we're working through that muscle. But it's not going to harm you in any way. This is a very safe area to inject fillers, even though it's makes people a little more nervous. Hold on. A little clog. 1 sec, guys.
What did it feel like? Did you feel anything?
Yes, a little bit. Pretty much as he described it. But it didn't hurt.
Did you hear any crunching?
I heard a pop.
Yeah, a lot of people always say they hate the little crunching that they hear, and that crunching is going through the muscle and directly on the bone. Also, there's always a little bit of air that's in the filler, especially if you mix in some numbing, and that air you hear much more when it's close to the bone. Perfect. So that's all done, and you can see bloodless. Go ahead and hold.
What kind of filler are you using?
That's radius, that whitish milky substance is radius. And what that does is, hold on, I'll tell you 1 second, that gives much more collagen production because it's made of a calcium base. I liken in areas, basically in the bony areas, like we did in the temple there, so we can get a lot of lifting and we can get a lot of long-term collagen. The next part is, because she has a more structured face, I really want to give her definition on her cheek. So we're going to do 2 techniques. We're going to do lateral injection technique using a cannula just to help limit bruising and pain. It's just going to feel a little weird. And we're going all the way down onto the bone into the deep medial fat pad, which supports the cheek. And this is a nice area to inject the filler because everybody gets this little line right here where the cheek starts to fall down. And by giving support deep here, it will lift this up. But what we're going to need to do too is fine tune it just a little bit with some injections. We'll do that after the fact. I'm just trying to get a nice subtle bit to start. I'm just going nice and slow. I like to take this area really slow, following a line from the corner of the mouth all the way up to the lateral part of the face to the top of the ear. This is the line we're looking for. That's the beauty line. That's the line I always tell people that's what the makeup artists use to really shadow and contour the lateral cheek. That's what we're going to use to build shape. And always people will ask me how much volume is needed per side. On average, if you really want to see something, especially with the lateral cheek, you're going to need a few syringes. She already has a really nice kind of shaping. We've done fillers about 6 months ago or so. So for her, this is kind of a touch-up, and it's just blending and balancing. But if you're coming in and you really want, you pull up a picture of Kim Kardashian or a Victoria's Secret model, they have a super high cheekbone and it's very shadowed, you're going to need numerous amounts of syringes. 1 syringe is only a very small amount. not a ton of volume. So for her, I'm giving her that nice shadowing. And then I'm going to blend the curve. This whole area here from temple to lateral cheek to under eye we call the OG curve because it's an area of beauty, it's an area of proportion. You can see now we're starting to get that shape. This is where the women really start to see a big difference and they get super excited, especially when they put their makeup on. I've had patients go right to their car and take a picture in their rear view mirror right after treatment with their sunglasses on, showing off that lateral contour because they're so happy. That's often where women are putting their makeup on the way to work.
Oh my gosh.
You
I
see
do
huge
that.
Do you do that?
Yeah, every day.
See, that's what I'm talking about. And so women will do that so that they're used to seeing that shadowed lighting through the rear view mirror.
Wow,
So
you're
now we're
so
going to do lateral lifting has been accomplished. Now we're going to go directly to the apple of the cheek. It's a little bit deeper than we were before. And give some pillars to just get some lifting to where the under eye and the cheek meet to blend. Good. Okay, that accomplishes the task. You can hold right there. I'm going to switch sides.
Wow, looks so good.
So show one side versus the other so people can see. And this is Restylane Define. Now this product has a little more substance, but take a look now. Look at the one side, lifted, and the other side, not. You can see it especially from overhead. So I'm going to have you switch sides with me. You can hold over here. Turn your head a little to the left. Perfect. Hold there. And we're going to accomplish that same task here. Now, defining the lateral part of the cheekbone. Turn a little bit this way. Giving a little lift to the midface. Go ahead. And using a reversible product called Restylane Define if we really needed to reverse it. Most people never need to. Sorry, okay. One more poke. Sometimes the cannula, since it's blunt ended, put it on, straighten it out, go ahead. There we go. Again, right through the tissue to that deep fat pad. Good. Again, in that support area, line between corner of the mouth and lateral cheek. Now, Restylane Refine and Define are the newer technology type fillers from Galderma. And these fillers are unique because they move with you. They're like honey. They get stuck to the skin and they hold on. And the reason I like that is then they don't migrate. These fillers are not going to be lumpy bumpy. They're not going to be little balls or lumps because they're just going to slide around with your skin. So if you smile, you laugh, you move, you go to yoga right after, even though I told you not to, filler is going to be fine. It's important to know because a lot of my patients don't listen to what I say post-treatment. So this is kind of a good product to use for the patients you know just don't want to follow the instructions. My patient here today, though, follows every instruction, so I don't have to worry at all anyways, but still, it's a good thing to know, and this is a great product for her because it's super soft. You can see we're starting to see that lateral definition now. We're getting highlight just a little bit higher above the bone. Doing nice threads here. And then that last little bit. Perfect. The last little bit. We're going to go 2 needle. Balance that little tear trough area. We call this the apple of the cheek. Sorry. Deep breaths. One more deep breath. Okay, hold right there. Perfect. Now I'm going to let that sit a second. I'm going to do now a little to her eyebrow because I like to get a little bit of lifting, and then I'm going to finish up the mid-face. So we're going to come up to the brow. We did the deep brow. Now we're going to come up right onto the bone here and just add a little bit of filler here. This is right at that arch most women call the gull wing part of the brow when we get that lateral third to lift. So we're just throwing a little bit of filler in there. And there's a space right here. If we place the filler there properly, it's going to just shrink. It's going to go right into the lateral brow and blend right in there. So push that down, and look at that lift. See that right there? That lateral lifting. Then we go a little bit deeper and give the deep support. And now she'll have a nice brow lift for like a year. Perfect. And then I'm just going to finish blending her lateral cheek. Smile again. Okay, relax. One more spot here. Good. Okay, hold right there for her. Good. I'll go to the other side. And we're all blending now. So again, that little spot right under the brow. Nice and slow, right into this safe area. You can see it's giving a nice lift right there. Good. Good, hold right there for her, nice and hard. And then your other hand, hold right there. Everywhere you go, you want to hold pressure, because the pressure is what limits any bruising and swelling. For her, though, we have to do a bunch of contouring. I'm just doing a little blending right now to give her cheeks a lot of balance. Perfect. Okay. I'll just switch with me from behind. Hold those fronts. So now we have lateral cheek, elevation of the brow. Now I want to soften around the mouth. So to do that, we're going to use a different filler. This is more for fine lines. And this is Belotero. And I love this filler because it's super soft. This is the one where you can go really superficial into the skin, little pinch, and do these little blebs, and it'll just soften without giving a lot of volume. Pinch. And what that does is it hydrates the skin. You can see, look how quickly. So the mouth corners, the chin crease, the folds, just makes everything look better. Marionette area. Smile. Good, relax. Following where she has natural creases. Just hold firm. Try to get over there. This is what's used for necklines, for under eyes. Go ahead and switch with me now. This is what's used for necklines, for under eyes, for elbow wrinkles, for just softening of fine lines, even in the hands. Go ahead and turn here. Good. And you can see even these little baby lines that she has, we can just inject very light. And what'll happen is, uniquely with this filler, is the filler integrates directly into the skin. It's the only type of filler that's known to do that, where it has exact dermal integration. So you can do these little pop-ups, and then within a few hours, it becomes the skin. It looks really soft. It's a nice natural look for people that don't want to have overdone. It's go to the lateral part of the eye. Are they asking anything?
No.
Really? They're just watching patiently, huh?
Watching hearts.
Hearts?
Saying,
Oh, yeah.
Dr. Jason, you are the best.
Oh, that's sweet. Well, we love you guys. Thank you. I love what I do. I want people to get a lot of education so they get the best results. I'm just going to give her a little to the under eye. Right here. Great. Now, lastly, and our favorite, I'm gonna have her take a little ice first, is to kiss her lips. I want her to kiss her lips. Hold right there. Hold that for her. We're gonna cool her down, even though we're gonna use a cannula. We're gonna limit oozing pain and swelling by using a cannula for the majority of her lips. And her lips are beautiful already. Go ahead and relax. You can see they're nice and pink. They have a nice shape. We just want to keep that shape, so we're going to use a softer filler that lasts about a year, Juvederm Volbella. And I love this for little touch-ups. You know, for her, you could see she has a nice Cupid's bow. Look all the way up with your chin and look to the left a little bit. And really quick, 1, 2, 3, good. Right here, we're at the Cupid's bow and really soft. It's always that initial poke. Never feels that great. But I'm only doing a little, and look at just that little bit, that little plump. See here? I'm going right up in the Cupid's bow. Okay. Good. So right there, we're done. Now, to maintain the results of this, you can do lip plumper like Lucy & Co., which we love, and you could start doing lasers. Even at-home micro-rolling helps build collagen in the lips. Okay, deep breath, 1, 2, 3, good. So right there, it's less painful than a needle, but not the best.
Can you do at-home micro-rolling if you already have lip filler?
Oh yeah, you should. Helps build collagen. See, I'm just contouring. Little bits, little threads. Just give her a nice little shape. Let's go to the bottom. Now her mouth, she has a longer chin, so it's okay to have a longer lower lip. Pinch. 1, 2, 3, deep breath. Right across, good. So right at the edge. Now with her, I don't want the whole lower part of her lip, the whole elongation. So I'm going to go about 3/4 of the way. And save just a subtle bit, because there's not much in the Volbella. She can ice again in between. I'm almost there. A little bit, you can see, nice and balanced. There's just a little bit of volume that's needed right here, so a little pinch right there. And then lastly, she has a nice Cupid's bow, a little at the top on both the Cupid's bow. Perfect. That accomplishes a nice amount of enhanced facial shaping. Let me just wipe her down so I can at least show her real quick. Then we'll ice. Obviously, it doesn't look like what it's going to look like long term, because she's going to be swollen and red and have blood. But once it settles, she'll be able to see everything. So I'll show you guys as well. It's anticipating what the result's going to be in a few weeks. So lateral lifting, go ahead and give her the mirror and show her before we do. Good. So lateral lifting in the cheek, a little bit improvement to the under eye. Temple and brow lifting, which is swollen. Lip, softening all the lines around the mouth and blending the jowls into the chin. I think it'll be great, and I think it will last us a good amount of time, because I think the last time we did this is probably 6 to 8 months ago. And you lost weight,
Yes.
which is also makes volume go down. So she still looked great even with the weight loss. So I wanted to keep losing the weight, and we'll keep her face maintaining, and she'll do great. So that is facial shaping in our young female.